Hi, I'm Ileana Sencio, and I'm performing the full head to toe assessment on my patient here. I have done hand hygiene. My patient is in a gown, and I have done patient education on what we are doing. Right now, he is fully clothed in the gown, but throughout the assessment, whatever body part I am assessing, then I will expose that body part. So I will start by assessing my patient's alertness and orientation. So what's your name?
Josh Schroeder
Okay, where are you?
in Evanston, Illinois.
Good. What's your date of birth?
September 7th, 1997.
Okay, and what's today's date?
April 14th, 2025.
Okay, and who's president?
President Trump.
Okay, very good. So the patient is alert and oriented. That is all normal. So we will get started on our cranial nerves. So the first one is our olfactory nerve, which is cranial nerve number 1. So I will have you cover up a nostril, and you'll close your eyes, and you're going to identify what the smell is. Okay, go ahead.
Chili salsa.
Okay, now the other nose.
The same habanero salsa.
Okay, very good. All right, so cranial nerve number 1 is intact. Cranial nerve number 2, which is the optic nerve, we are going to assess our central vision with the Snellen eye chart. So I will have the patient standing 20 feet away from the chart, and the patient will read the lowest line that he can clearly. So normal is 20/20 vision. Now for the peripheral vision, we're going to do the confrontation test. So I'll have you cover your cover one eye, and then let me know when I am coming close to you. Okay, now do the other eye. Once again.
Yeah, I see it.
Okay, very good. So that is normal. All right, so for cranial nerves, number 3, 4, and 6 are ocular motor, our trochlear, and our abducens. I have my pen light here. I'm first going to have the patient follow my pen light with just the eyes. And I am looking for smooth movement in just the eyes, which he's able to do. Very good. Let's pretend that the light is on. So I'm gonna come in from the side and then check for the light reflex. And the patient's eyes, or the patient's pupils, are equal, round, and reactive to light, and they accommodate. So when I go forward, they accommodate. When I go back, they also change. Okay, very good. So that is all intact. Okay, so for the cranial nerve 5, our trigeminal. So I am going to first palpate the temporalis, then the masseter, and I'm going to have you clench your jaw. Okay, very good. So he's able to do that. There's no swelling, there's no inflammation. That looks great. Now I am going to have a cotton swab, and I will have you close your eyes, and then you're going to let me know where I am touching on your face.
Top forehead.
Yep.
Right cheek. Left cheek. Chin.
Okay, very good. So I'll put my little thing back. Okay, now the next one is our facial nerve, which is cranial nerve number 7. So for our cranial number 7, these are the facial expressions. So go ahead and smile real big. Go ahead and raise your eyebrows. Okay, and then puff out your cheeks. Okay, very good. So that is intact. Okay, so cranial nerve 7 is great. Now we're going to do cranial nerve number 8, which is our acoustic and our vestibular cochlear. For the gait and the Romberg's test, we're going to wait to do that for the next section, but right now we're just going to focus on the 3 tests, which is our whisper test, our Weber test, and our Rhine test. So for the first one, our whisper test, I'm going to whisper something in your ear, and then you will tell me what I whispered.
Fire.
Okay.
Shoes.
Okay, very good. For the Weber test, I'm going to have my tuning fork, and I'm going to vibrate it. I'm going to put it on the top of the patient's head in the middle, and what I'm assessing for is making sure that the patient can hear the tuning fork vibration equally on both sides, which he's able to, so that is normal. The next one is the Rhine test. So I'm comparing the air conduction and the bone conduction from the mastoid bone. So I'm going to vibrate it, and I'm gonna put the tuning fork on the mastoid bone, okay, and then I'm gonna vibrate it again and just put it on the outer ear. And what is a normal finding is that the air conduction will be louder than the bone conduction, okay, which it is. Okay, very good. All right, for the next one is our cranial nerve number 9, which is our glossopharyngeal. So cranial nerves number 9 and 10, which number 10 is the vagus, they will be tested together. So, okay, first I am going to assess the gag and the swallow. So I will have you open your mouth, okay, and then if I had the tongue depressor, I would induce a gag, okay, so he would gag, go ahead and swallow. Okay, very good. And then I'm assessing also his tongue. And we can also here assess his cranial nerve number 12, which is his hypoglossal. But basically open your mouth, say ah. Very good. So I'm looking that his uvula rises equally and symmetrically together at the same time. Okay, so very good. Go ah. So that is our cranial nerve number 10, our vagus nerve, and then for the 12, I'll have him stick his tongue out and then go side to side. Okay, very good. So there is no tongue deviation, and he's able to do that smoothly and great and effortlessly. Okay, now we are going to do cranial nerve number 11, which is our accessory. So I will have you shrug your shoulders. Okay, very good. Now I'm going to add resistance. Go ahead and shrug your shoulders. Very good. And then I'm going to have him turn, so I'll have you turn your head, and then you're going to turn it against my palm. Very good. And then turn it again. Okay, very good. So he's able to do that even though I added resistance, and that is a normal finding. Okay, very good. So I am seeing the patient is able to do it against resistance, and that looks really good. For his hypoglossal, like I said, his tongue is midline. Go ahead and stick it out. And there's no protrusion and no deviation, which that looks normal. So I assessed all of his cranial nerves, and they all look great, and they're intact. Okay, very good. Okay, now we're going to get into the next section, which is our cerebellar, like fine motor skills. So we can start with your gait. So go ahead and stand up, and I'll have you, you can just go around the chair, but you'll walk to the wall and then walk back. So while he's doing this, I am making sure that his gait is, it's balanced, it is smooth, and it is effortless, which it is. So very good. And I'll have you keep standing here. Now we are going to assess the Romberg's test. So you'll go ahead and just put your hands to your side. And we are going to make sure that when you close your eyes that you are nice and balanced, and you're not like leaning side to side or anything, and that looks very good. So Romberg's test is normal, and it is negative. Okay, so now we are going to do the pronator drift. So I'm going to have you have your arms go to out in front of you, and we're going to assess to see if there's a drift, which there's not. So that test is normal. Okay, so go ahead and sit down. Okay, so now we are going to do the rapid alternating movements. So I'm going to have you kind of just go like this with your palms back and forth. Do it rapid. Okay, that's normal. He's able to do it with no issue. That looks great. Now we are going to do the point accuracy test. So I'm going to have my finger, I'm going to put it in 3 different positions, and you will touch with your index finger, my finger, and your nose, and back and forth. Okay, go ahead. Okay, very good. So he was able to do that without difficulty and was very accurate with my index finger and his nose. So that is all around normal test. So very good. Okay, so we're done with we did our gait, we did our Romberg's test, we did our accuracy of movement, rapid alternating movements, and pronator test. That all looks great. So now we are going to do our primary sensory. So let's first do our superficial touch. So I'm going to touch you in different areas. You just let me know where I'm touching you. Okay, so close your eyes.
Left upper leg, right lower leg, right lower arm, left lower arm.
Okay, very good. So that is a normal test. So now we're going to do superficial pain. I'll grab another like tool that's a little bit a little harder. Same thing, but just a little bit more pressure. So close your eyes. Let me know where.
Left lower arm, right lower arm, right lower leg, left lower leg.
Okay, very good. So that is a normal test. So because our superficial touch and superficial pain are normal, we don't have to do the deep deep pressure and pain. Okay, so now we're going to do the vibration. So I'm going to have my tuning fork, and I'm going to have it vibrate, and I'm going to put it over a bony prominence, and he will tell me when the vibration has stopped. So we'll do that, and then we'll put it over the elbow, and then he'll let me know when it stopped. Okay, very good, normal. Okay, now we're going to do the joint position proprioception. So I will have you close your eyes, and then I'm going to touch you in a part of your body, and then you just touch that same area that I touched you. Okay, so here. Okay, very good. So that is a normal test. Okay, so our primary cortical is normal. So now we're gonna do our strength. So I'm gonna have you grab my hands and pull me. Okay, push me. Very good. Resist my pressure here, like flex your legs. Okay, and then. Okay, I guess extend and flex, sorry. Okay, very good, super strong, 5 out of 5 strengths. Okay, great. Now we are going to go into our reflexes. So I'm gonna have a hammer now, and I will assess his bicep reflex. So I'm gonna put my fingers here, and I'm gonna go against my fingers with the hammer, so with his bicep. So what I'm looking for is for his bicep muscle to contract and his elbow to flex, okay? Very good, normal. Now I'm gonna go down, I'm gonna go to his brachioradialis reflex. Once again, strike the hammer, and I'm looking for his wrist to flex, which it is, so very good. I'm looking for the wrist to flex and for his forearm to be pronated, very good. Okay, the next one is the tricep reflex. So go like this. Strike the hammer. I'm looking for the tricep muscle to contract and for the elbow to extend. So we'll go very good. Okay, now we're gonna move down to his patellar reflex. So right under the patellar, once again, I'm gonna strike the hammer. I'm looking for his quad muscle to contract and for his knee to extend. So knee to extend, quad to contract. Very good. Okay, now we are going to do his Achilles. So I'm going to have his leg in dorsiflexion, and then I'm going to strike the hammer on right here in his Achilles, and I am watching for his foot to plantar flex. Plantar flex. Okay, normal. Very good. All right, those are all of our deep tendon reflexes. So now we're going to do our superficial reflexes. The abdomen, I am going to wait until we do the abdominal assessment. And then for his cremasternic reflex, because since he's a male, I will strike the side of his knee, or the side of his leg, and whatever side of his leg I strike, his testes, and his testes, and the scrotum should rise up on that same side that I stroke his thigh on. Okay, and that's normal. And now the plantar flexion, I am going to, or the plantar reflex, sorry, I am going to, or we can do this one. I'm gonna strike, sorry, it's a little hard. I'm gonna strike the side of his foot, and then a normal test is that he's gonna plantar flex. So downward, and that looks great. Okay, very good. That's all normal. Okay, so that is, okay, so now we're gonna get set up for the meningeal irritation. Okay, now we are assessing the meningeal irritation. So we are gonna start with the nuchal rigidity. So I will be having the patient flex their head, and I am making sure that there is no resistance, or pain whenever they flex their head. So go ahead and flex your neck. Okay, very good. Did you have any pain with that?
No.
Okay, so that is a normal test that they did not have that. Okay, so the next one is the Brudzinski's test. So same thing. It's kind of, it's an extension of this last test that we just did on you, but now I will be assessing your hips and your knees. So go ahead and go like this. Very good. We already said that there was no pain. So, and the patient also kept his knees and his hips flat, and that's what we're looking for. That is normal. The next one is the Kernig's test. So you can just stay like this, stay like that in your upper body. I'm going to lift your leg up, and you're gonna let me know if there's any pain. Any pain?
No.
Okay, very good. Now the next leg. Any pain?
No.
Okay, very good. So that is a normal test for the Kernig's test, a negative test, so we are good in that section. Okay, the next section that we will be getting into is the head and neck. So we will be doing the inspection, the palpation, and the auscultation. So let's start with the inspection. So I am first just looking. I'm looking at his head, that it is midline, it is normal cephalic, it is symmetrical. There is no trauma or deformities that I'm seeing. Have you had any recent traumas?
No.
Okay, very good. I'm looking at his hair distribution. It looks really great. There's no bald patches anywhere, and yeah, it's growing in normal. I'm noting the hair color, which is brown. And I'm looking at his head, and there is no lesions that I see at this moment. For his face is symmetrical. There's no abnormal features, or there's no abnormal twitching, like involuntary movements such as twitching. The next section is the neck. So I'm looking at his neck. It is symmetrical. There are no masses and there are no lesions. There's no webbing at the base that I'm seeing right now. His muscle development is appropriate for his age and for his career. There is no JVD. Very good. There's no carotid artery pulsation that I can see. His trachea is midline. Very good. For his thyromegaly, I'm going to have you look up, okay? And his thyroid looks great. It does not look inflamed. I'm going to have him do his ranges of motion now. So I will have you flex to 45 degrees. I'm going to have you extend to 55 degrees. So extend your head to 55 degrees. Very good. And then go side to side, 35 degrees, 70 degrees, and then lateral bending, about 40 degrees each side. So did you have any pain with that?
No.
Okay, very good. So that is a normal finding. Now we will go into the palpation section of our head and neck. So the head, noting his hair texture, it is fine. There is no tenderness, or is there tenderness?
No.
I'm not seeing any masses or deformities here. It all looks great. Okay, now we will go next to his temporal artery. There's no tenderness, thickening, or hardness. Okay, that looks really good. His TMJ, we'll put it in, I'm going to put my index fingers in front of his tragus, and then I'm going to have you open and close your mouth over. Yep, open and close, open and close. There is some cracking, but that is normal and known by the patient. All right, so the Chvostek sign. So I'm just going to palpate the front right here. Okay, very good. And I'm checking for twitching. And this could indicate hypocalcemia. And there's none here, so that is a normal sign. Now we have our salivary glands. We're going to palpate our parotid, our submandibular, our sublingual. And there is no signs of inflammation noted. That all looks normal. Now we're going to do our sinuses. So we have sinuses up here, which is our frontal, and then our maxillary sinuses. Do you have any tenderness when I palpate?
No.
Okay, very good. So that is normal. All right, now we're gonna go to our next section for our palpation. So we have our lymph nodes. So for our lymph nodes, we're looking at our occipital, our preauricular, postauricular, tonsillar, submandibular, submental, posterior, anterior neck triangle. Okay, our supraclavicular, very good. Our infraclavicular, okay, and then our epitrochlear, which is in our bicep areas, and then our, which I will not do, but our inguinal, and then our popliteal lymph nodes. None of them are inflamed. And he does not have any. Do you have any tenderness anywhere that I touched you?
No.
No? Okay, so that is a normal finding. And then we're going to look at the trachea. We're going to palpate it. It is midline, which looks great. And then our thyroid. So go ahead and stand there. Or sorry, sit there. You can stay right there. I'm going to be behind the patient. I'm going to put my hands in front of his neck, and then I'll have you swallow. Okay, very good. So that looks great. There is no thyromegaly there. Okay, Now we're going to go to the auscultation portion of this assessment. So for the carotids, I'm going to assess with the bell. Okay, very good. I'm going to assess with the bell, and I'm going to assess the carotids. Making sure that there's no bruise. Okay, and no bruise, which is normal. Now, for the thyroid, I would auscultate it if it were enlarged, but it's not enlarged, so that is not necessary to do right now. Okay. All right, now we're going to get into the next section of our assessment, which is the ears, nose, and throat, so the ENT. First, we're going to start with the assessment of our ears. So go ahead and turn your head. Very good. So I'm looking at his ears, making sure that they are equal size bilaterally. So that looks good, and that looks good. Yep, they're equal size. I'm also assessing that they're positioned at 10 degrees to the skull, which they are, and they are normal set. Very good. The pinna is well formed. There is no lesions or discolorations on the outside. Let's check the other one. Same thing. It's well formed, and there's no lesions on the outside. Very good. I'm making sure that the external auditory canal is pink and it's uniform. Very good, pink and uniform, and that there's no signs of any exudate or inflammation, which there's not. So that is normal. Okay, so I'm gonna get my otoscope for the otoscopic exam. So I'm gonna pull the pinna up since he's an adult, so up and away. I'm gonna look inside to see how his ear looks. So I am expecting to look to see a pearly gray inside. I am able to detect the bony prominences, and then for the left ear, there should be a light reflex at the left ear is the light reflex at 7 o'clock, and the right ear is a light reflex at 5 o'clock. Okay, very good. For the hearing assessment, we already did the hearing assessment, which was the whisper, the Weber test, and the Rhine test, so we don't have to repeat those. Those were all normal. And now we're going to get into the nose. So let's look at the nose. The nose is equal on both sides. I'm going to have you look up to look at your septum. The septum looks midline. Both of your nostrils also your mucous membranes look moist and pink. Very good. Your septum is midline with no deviation, perforation, or lesions, and there is no rhinorrhea. Very good. So that is all normal. So now we're going to look at the throat. So your lips are pink and symmetrical. They do not have any lesions. Go ahead and open your mouth so I can look at your mouth mucosa. Very good. It looks pink. It looks moist. There are no lesions that I can see. The gingiva, go ahead and kind of raise your gums up. They look pink. Very good. There's no inflammation. There's no lesions that I can see as well. The teeth, go ahead and open your mouth. Have you had any teeth extractions?
No.
Open your mouth. Okay. There should be 16 at the top, 16 at the bottom, 32 teeth total in total. And then we are going to look at the hard and soft palate. Open your mouth. That is all intact. Okay, very good. And again, no lesions, no extreme redness or anything that looks abnormal there. Okay, so now we're looking at the tongue. So once again, go ahead and stick out your tongue, kind of side to side. There's no deviation. He's able to move it with no restriction, and it all looks great. We're looking at the floor of the mouth as well. So go ahead and lift your tongue up. Okay, very good. The tongue, there is no, the floor of the mouth looks moist without any lesions. I'm looking at the frenulum. The Wharton ducts are non-injected. Let me see. Open your mouth. That looks great. And then the posterior pharynx is pink moist. There's no exudate and no postnasal drip. So he is all healthy. All right. So now we're gonna palpate. And there's no need to palpate the throat or nose. And then the ear, just again, palpating the pinna, the tragus, the mastoid process. Any tenderness?
No.
Okay, very good. All right, that concludes that portion. Okay, I will also like to add for the throat inspection, when he opened his mouth, go ahead and open your mouth. I was also able to see that his Stensen's ducts were also not injected. So both the Stensen's ducts and the Wharton and the Wharton ducts are non-injected. Okay, getting into the eye portion of this exam, for the visual acuity, for the central vision, we already did the Snellen eye chart test at the beginning of this video, and it was 20/20, so that was normal finding. For the near vision, we're gonna do the Rosenbaum pocket test. So I will hold it 14 inches from the patient. I will have the patient read the normal print, and if he's able to read the normal print, then and his near vision is intact, that is a normal finding for that. The confrontation test we already did at the beginning of this exam as well, of this video, so we don't have to do that. We did that with the cranial nerves. We don't have to repeat it. For the extraocular motor, we also did that at the beginning of this video with the cranial nerves, and those were all intact. So we'll get into the inspection. The inspection will look at his orbital area. So his eyebrows are nice and full, they're symmetrical, and they are bilateral. His eyelashes, they're again nice and full, there's no areas of baldness. So that all looks great. His palpebral fissures are symmetrical and horizontal. There's no edema, there's no lesions, and there's no discoloration. So now we're gonna get into the lacrimal apparatus. There is no redness or swelling noted. That all looks great. For his conjunctiva, I'm going to have you look up. I'm gonna look at the conjunctiva. That is like red, and it is pink, moist, and there's no signs of infection. There's no signs of infection. Very good. For your cornea, let's look at your cornea. Okay, very good. It is nice and clear, round with no lesions. Your corneal sensitivity, I'll have a cotton swab. I'll go to the side, and then normal finding is he blinks. So same thing, cotton swab, side of his eye. Normal finding is that he blinks. For his corneal light reflex, it is the reflex that we did at the beginning with our cranial nerves, which his pupils were equal, round, and reactive to light, and they accommodated. So everything is normal there. And then for his iris and pupils, we're going to note his iris color and shape. So it is round, and then the blue. And again, the perla here we already did, so we don't have to repeat that. For his lacrimal apparatus, his duct is palpable lower orbital rim. Okay, everything's palpable, that looks great. No signs of inflammation, redness, or drainage. For his gland, upper lateral eyelid looks normal. Gland is, it's normal if it's not palpable, so it's not palpable, so that's great. For the fundoscopic exam, so I'm gonna have an ophthalmoscope, and the ophthalmoscope, I'm gonna just look into his eyes. Okay, looks great. I'm gonna look that there's a red reflex present bilaterally, that his eyes, they look bright and yellow with well-defined or very good with well delineated borders. The vessels are intact, and the retina is uniform in color with no lesions, which it is. So that all looks great. Okay, hi, now we're gonna get into the chest and lung section of this assessment. So first we're gonna start inspecting. So I'm gonna look that the patient is breathing around 16 to 20 breaths per minute. It looks unlabored. There's no abnormal wheezing or abnormal sound. That all checks out. Go ahead and just breathe normally. Okay, very good. I am looking at the symmetry of his chest, and it looks symmetrical. His thorax elliptical is about 45 degrees. His AP transverse ratio is around 1 to 2, so that looks really good. I'm also looking in this area, which is the costal angle symmetry. This is where the ribs meet the sternum, and that looks great. It should be around less than 90 degrees, so that checks out. There's no venous pattern noted. It's fine, it's symmetrical, and there's no anatomical chest abnormalities like kyphosis or lordosis or pectus excavatum. I'm also looking at his nail beds, making sure that they're pink and they have a cap refill of less than 2 seconds, which they do. Okay, very good. Now we're doing the palpation portion. So his trachea is midline, so that all checks out. Okay, very good. There's no masses that are noted. It is symmetrical on both sides. Now I'm going to check for a tactile fremitus. So go ahead and say 99.
99. 99.
Okay, very good. So then I'll go behind him. Go ahead.
99, 99, 99.
Okay, and I'm just assessing for vibration, and I am doing it with this part of my hand. Okay, so like I said, that there's no tenderness, masses, there's no pleural friction rub that I can feel with my hands. The chest excursion is, when he's breathing, it's about 2 to 3 inches, so that looks great. And his tactile fremitus, it is vibrating, which I felt with the palms of my hands, and it's present at the angle of Louis, and or it gets diminished at the periphery bilaterally as we go out. Okay, so now we're gonna get into the percussion portion. So just gonna percuss and make sure that it is resonant and it gets dull as we get closer to the diaphragm. Okay, very good. Okay, so that checks out. Now I'm going to assess for the diaphragmatic excursion. So like I said, percussing down, it goes from resonant to dullness, so that checks out. And then his excursion is 4 to 6 centimeters, and it is symmetrical bilaterally. Now we can auscultate. So I'm going to listen to his lungs with the diaphragm and making sure that it is nice and clear as I go down, and I'm comparing both the right and the left side. So you can just breathe normally. Okay, very good. I'm going to have you say 99 as well.
99, 99, 99, 99.
Okay, and that all sounds muffled, so that sounds great. Now go ahead and, so the 99 is assessing for bronchophony. Now we're going to do the whisper pectoraliquy. So now go ahead and say 1, 2, 3, and I'm again assessing to make sure it sounds muffled.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, very good. And then the last test that we're assessing is the egophony. So go ahead and say E.
E, 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 E.
Okay, so it sounded muffled and I could still hear the E. If it were to change to A, then that would be abnormal. So that all checks out. Very good. Okay, so that is the section for the chest and lungs. Okay, now getting into the next portion of this head to toe assessment will be the heart and blood vessels. So I have my patient laying down. His head is at 30 to 45 degrees, and I'm looking at his neck and at the angle of Louis. So I'm seeing that his neck is flat, there's no distension, so that all looks great. If the normal would be 2 to 3 centimeters for the JBP at 30 degrees. The next thing I'm going to assess is his hepatojugular reflex. So I'm going to press down on his stomach for about 30 seconds or a few cardiac cycles. Okay, and once I release, I am looking at his neck. His neck should return to normal 10 to 20 seconds, or not normal, should return to his baseline 10 to 20 seconds after I have released. And again, his neck looks flat, so that is normal, and that all checks out. Okay, so I'm gonna have you sit up. Okay, so just like I inspected last time at his fingers, I'm making sure that they are pink, they're moist, there's no clubbing, and they're flat, and the cab refill is less than 2 seconds, which it is. So same thing here, less than 2 seconds. Okay, very good. So that all checks out. Okay, now I am looking at his pericardium section, making sure that I don't feel any pulsations over that area, which I don't. So just to point out some key landmarks that we will be assessing here in a second. We have our aortic. So our aortic is the second intercostal space, the right sternal border. Then we have our pulmonic. The pulmonic is the second intercostal space, left sternal border. Our Erb's point is the third intercostal space, left sternal border. The tricuspid is the fourth intercostal space, left sternal border, and then the mitral is the fifth intercostal space, mid-clavicular. So just some key points to point out there. And if I'm able to see his apical index, then it'll be in the mitral space about 2 centimeters, if that is visible with a light tap. Okay, now the palpation. So once again, assessing here. There are no thrills or any heaves. Okay, so for auscultation, we'll just get right into it. First, I'm gonna start with my diaphragm, and then I'll switch to my bell. Okay, so your aortic, pulmonic, your herbs, your tricuspid, and then your mitral. Okay, that looks very good. I did not, it's high pitched. Your S1 and S2 sounded normal. Then switching to my bell, same thing, same areas. Okay, very good. So once again, that sounded really good. No murmurs, and that all checked out. Okay, now going into the next section of this assessment, which is the vessel assessment. So I am assessing his skin, making sure that it looks pink, and it is symmetrical throughout. There's no lesions, there's no edema. So I'm looking at his upper extremities. This all checks out, and I'm also looking at his lower extremity. There's no edema. There's no, and his skin looks pink. It looks healthy, and even throughout on both sides. Now we are going to look at his arterial pulses. So starting with his temporal artery. Okay, and then comparing both sides. His carotid artery, comparing both sides. One at a time, making sure that it's 2 to 4, 2 out of 4 for the pulsation. Very good. His brachial artery, his radial artery, his ulnars, and ulnar artery, his femoral artery, which is just in his groin, his popliteal on both sides. Again, comparing both sides and making sure that they're 2 out of 4 strength, or 2 out of 4 for his pulsation, and then his dorsal pedis and his posterior tibialis. Once again, his DP and his DP and his PT. Okay, very good. So they are both the same, 2 out of 4, and they are symmetrical on both sides. Okay, now we are going to do the Allen's test. So the Allen's test, I'm going to have him go ahead and make a fist. I'm going to include your radial and your ulnar artery. Okay, go ahead and release that wrist. Very good. And then I'm going to release the ulnar artery. So I'm seeing that his hand returns to a red color in about 6 seconds. If that is the case, then I know his ulnar artery has enough perfusion that if we were to need his radial artery for like an arterial line, then we can do that. It's a good candidate. So same thing on the other side, make a fist, including your radial and your ulnar artery, release the fist, releasing the ulnar artery, making sure that that color returns back to red in about 6 seconds. So really good. Now the last one is your Hohmann sign. I'm gonna help you with your foot. Go ahead and point your feet up. So we're gonna dorsiflex. If there's any pain here in the calf, then that is a positive Hohmann sign. Okay, very good. Okay, going into the next section of this assessment, which is our abdomen now. So the first thing I'm gonna do is I'm going to inspect. So his abdomen looks flat. There are no masses. There's no hernias. There is, like I said, the contour is flat. It's symmetrical. His skin color is uniform. There's no grays turners in the back. There's also no Collin sign around the umbilicus, and there's no bulging vessels apparent in his stomach as well. Next we are going to auscultate. So for the auscultation, first I'm going to start with my diaphragm, and then I will go to my bell. So for the auscultation, I'm assessing in all 4 quadrants. Okay, very good. So that all sounds good. He has active vowel sounds, and there is no concern there. Next, I'm going to assess for his abdominal arteries, and this will be with the bell. And what I'm assessing for is making sure that there is no bruit. So, I know it's kind of hard to tell. Let me see if I can face that. There we go. Okay, that's way better. Okay, so I'm gonna start with the aorta here. Okay, his left and right renal artery, his left and right iliac artery, and then his left and right femoral artery. Okay, so that all checks out. There is no bruit and that all looks normal. Okay, now going into the next section, which is the percussion of the abdomen. So I'm going to percuss all 4 quadrants, and I'm expecting to have tympani dominate since it is an air-filled area. So we'll percuss. Okay, very good. So that's your tympani. So now we're going to go to the liver. The liver is in the right upper quadrant, and the upper margin, I will not be able to percuss because it is protected by the ribs, but the lower quadrant I can. So I'll start from the bottom and then work my way up to the costal mid-clavicular area, and it should be tympani, which will change to dullness. So now for the liver descent, I'm gonna have I'll have you take a big deep breath in. Okay, and then do it again. Okay, very good. So for the liver descent, I should expect the liver to descend 1 to 2 centimeters below the original lower margin. Very good. So now for the spleen is in the left upper quadrant in this area. And normally it would not be enlarged, so we should expect it to just, to show no like splenomegaly sign. So we will percuss it at the left intercostal and anterior axillary line, and then a tympani once again with this area at the midclavicular 11th rib. Okay, very good. Now for the CVA, we will come back. We will do that once the patient is sitting up. So we will come back to that. The liver first percussion should be no tenderness, and like I said, it should be in this area. Upper we don't have to assess, but the lower we will be assessing. So now the liver scratch test. So I'm gonna have my stethoscope at the liver here in this area, and I'm gonna start from the bottom and start scratching. Okay, so what I'm expecting is that as I get closer and closer to the border, the scratching will get louder and louder and louder. Okay, and it's more magnified. Now the abdominal reflexes, I will have a cotton swab, and I'm going to go around the umbilicus, and the umbilicus should go reflex towards that stimulus of that cotton swab. Okay, very good. Okay, for the last section of this assessment, now we are going to get into palpation. For the palpation, we'll first start light, and we always want to assess the painful areas last, but he's having no pain, so we don't have to worry about that. We'll start at the right side, at the right lower quadrant, and my light palpation is going to be about 1 centimeter deep. Do you feel any tenderness, any pain? Okay, very good. All right, and then I'm going to assess for the liver. Okay, and then the spleen will be in this area. I'm not feeling any masses, inflammation, or an enlarged organ, so that all checks out. Okay, and then I'm going to go into the deep palpation, which is about 5 centimeters. Once again, do you have any pain, tenderness? No. Okay, so that all checks out. Okay, very good. And the patient also had no guarding or rigidity. Okay, so now I'm gonna have you sit up, please. And this is where we are going to do the CVA tenderness test and assess for the kidney. So I'm gonna come back here. Actually, do you wanna turn that way? Yeah. And first I will percuss at the 12th rib. It's about here. Okay, very good. Okay, do you have any pain or tenderness?
No.
Okay, and then once again, I will palpate, make sure that he has no tenderness or pain. If he does, this could indicate like kidney inflammation, infection, or stones, which he doesn't. All right, and that is everything. Okay, thank you so much for listening. Bye.